Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. For the month of January, we're focusing on how the past year of Trump administration policies has impacted health. The Missouri Immunization Coalition was a nonprofit that focused on advocacy, education, and training around vaccines. Funding cuts to the Centers for Disease Control and Prevention in April last year led to a loss of funding for the group, and they were forced to shutter last summer. Linnell Phillips, the coalition's board president, sat down with Robin Vanderbeck, a staff member, to discuss what the group did and how their closure could impact vaccination in the state. Here's Linnell.
The idea to form the coalition was in 2018, 2019, where we realized that all of the professionals that advocated for immunizations were just sort of dispersed among different organizations. So you had like Primary Care Association, you had the Nurses Association, you had Public Health Association. And so in all of our own ways, we would advocate for immunizations, but we weren't coalesced into one voice. And the anti-vaccine movement is coalesced into one voice. So early on, one of our main activities was working with the local health departments to enable them to be able to give COVID shots. Some of it was very logistical, like if they needed a deep freeze freezer for the mRNA vaccines, we'd buy them a deep freeze freezer. If they needed educational material, we would make educational material. Whatever they needed, we were facilitating their ability to do their job. Later on, we had to zoom out to childhood vaccines, regular adult vaccines.
I feel like now, especially with all of the confusion around vaccines, I feel like Immunization Coalition could have done a lot with that to have one central spot of information to continuously keep that updated for like providers, especially as we did like monthly meetings and things like that. So that's something I definitely would have liked to have done if I was still there.
I think it's just the vacuum of information. I mean, we were the go-to, and I think the state conference was a really important source of collaboration and morale. I mean, it's community, like, how hard it is to be involved in the vaccine business right now. And it's such a challenge. And I feel like we offered information, we offered moral support, we offered a sense of community. So you're not just isolated out there giving shots all day, like, you're part of a whole community. I think our providers are out there unsupported. I think our parents are out there unsupported. And I'm very fearful of the sort of the vacuum of information out there and advocacy.
That was Linnell Phillips and Robin Vanderbeck of the former Missouri Immunization Coalition, speaking about the possible future of vaccination in the state. That's it for this week's Missouri Health Talks, which was reported by Najifa Farhat and produced by me. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.